Hello friends, welcome to the new episode of Backside Story. I am a gastroenterologist currently practicing out of New York and Connecticut in the United States. And this is my channel where I discuss various evidence-based research-proven tips to improve gastrointestinal health, digestion, improve weight loss, de-stress, and improve life in general. Today, let's talk about how to improve physician-patient relationship. Well, before I delve into the main topic, let me share with you a personal story. After residency, I spent a year at the Mayo Clinic in Rochester, Minnesota, learning about neurogastroenterology. This is a specialization of gastroenterology where you learn about diseases that are manifested because of changes and alterations in neural mechanisms of the digestive tract, leading to abnormalities in gut motility and visceral sensitivity. It includes a heterogeneous group of disorders such as irritable bowel syndrome, dyspepsia or indigestion, bloating, chronic constipation, and so forth. These group of disorders are generally called as functional GI disorders, which means that even detailed medical investigations may fail to reveal a clear known cause. Such group of disorders are very frustrating both for the patients and the clinicians. Why for the patients? Because no one with debilitating illness likes to hear that it is all in your head. Yet, this is what patients with these distressing symptoms hear, either implicitly or explicitly, because their detailed medical workup has been unyielding. Why it is sort of frustrating for clinicians? As a clinician, we are trained to aim for cure. These disorders are not as scientifically comprehensible even for doctors. Therefore, explaining them to the patients becomes a challenge. We use medical jargon which leads to poor communication. Repeated bouts of distress and pain sometimes forces a clinician to prescribe futile treatments. This makes the interactions more challenging. I saw many such patients arriving at the Mayo door, sometimes for far-flung places. These patients seemed hopeless due to their detailed prior negative medical investigations. They were worried, talking incessantly as if trying to prove their illness more legitimate. We must acknowledge that the role of a doctor is not only to cure all disease but also to promote healing. Augmenting health physically, emotionally, and spiritually is what transforms a doctor into a true healer. One technique that can help to achieve this is an effective patient-doctor relationship. In our scientific discipline of medicine, this art and technique is often overlooked. It has served me well throughout my years of practice, and I continue to promote it and teach it to my trainees when they rotate through my practice. Although it is an art and skill, it can be learned. The hallmarks of an effective patient-physician relationship are 4 E's. Number 1, effective listening. The key elements of this are pay attention, defer judgment, and respond appropriately. Number 2, empathy. Key elements: imagine their point of view. Do not make assumptions. Number 3, explain. Scientific explanation of patients' symptoms in a very easy to understand language. And number 4, establish goals. Partner with your patient to establish therapeutic goals together, aiming for symptom management and not only cure. The therapeutic effects of an effective doctor-patient relationship are at times greater than the effect of the pharmacological agents employed. For patients, it leads to better engagement, more self-management, increased satisfaction. For clinicians, it results in reduced medical costs, decreased likelihood of medical malpractice claims, and enhanced job satisfaction. This particular statement that I found on internet summarizes it very succinctly. A good physician treats the disease, but a great physician treats the patient who has the disease. Thank you very much for listening. Keep smiling.